It's the morning show with Phil and Bob, but unlike the first 2 hours where it was Bob Maschio, now it's Dr. Bob Olivieri. Welcome, Dr. Bob.
Thank you.
Today we're going to talk about something that I've heard you talking about. You have seminars on this, and I don't even want to try to pronounce it, but hit me up with it. What is it?
It's called peripheral neuropathy.
Peripheral neuropathy. Okay.
Right. And today we're going to talk about what it is because it's kind of a confusing topic, and quite frankly, a lot of people that have it don't know they have it, and a lot of people that think they have it do not have it. So we're going to kind of clear that up a little bit. We're going to talk about what causes it and what can be done to help your problem, help your condition, because unfortunately the treatment that's available out there to the majority of citizens, unfortunately, really doesn't work, and they have very poor success rate with it. So we have a program that I believe is life-changing, and the people that have gone through the program, I believe, will validate that. We have a lot of testimonials on our website, and so we're going to talk about it.
Are the symptoms of peripheral neuropathy similar to symptoms of other diseases, and maybe it could be misdiagnosed?
They are. Yeah, they are. And so lots of times, I mean, we get people that come into the office that have something as simple as like plantar fasciitis, and they think they have that. Or they have spinal stenosis that's causing some numbness and weakness. So we're going to talk about some of the symptoms, but the condition itself is extremely common. I mean, the particular disease has become very chronic in the United States, and it affects about 20 million Americans. And I believe the reason why it's getting so big and it's growing every year is because of diabetes.
Is this an age thing? Does it affect a certain age group more than others?
Yeah, you usually see it in people over the age of 50. I mean, it can affect people younger than that, but usually it's over the age of 50 because that's when usually, I would say probably about 40 to 50% of the cases that we see in our office are diabetics. Mm-hmm. But it doesn't have to be. It can be chemotherapy related, and we're going to talk about all the different things that can actually cause this. There's like over 200 causes of peripheral neuropathy. And, they'll call it idiopathic. They throw it in a category, but idiopathic just means we have no idea what causes it, and so because if they have some inkling, they're going to throw it into a category, so the idiopathic peripheral neuropathy is really common, but we see a lot of diabetics that get it, or people that just have higher blood sugar because, in its common, in its easiest sense to describe, it's the electrical wiring in your body, the nervous system is actually breaking down, and your feet and hands can't communicate with your brain, and your brain can't communicate with your hands and feet. And so what happens with that is that you start to get some pretty bizarre symptoms. But basically what peripheral neuropathy means is peripheral means that it's further out from the center of the body. Like you have the central portion and then outward. Neuro means nerves, and pathy just means abnormal. So a really fancy name to describe something that's pretty kind of simple.
Gotcha.
But the symptoms, that's like really the whole key, because this is why people get really, really confused on whether they have peripheral neuropathy or not. They're going to have some of the symptoms of it. You can have like burning in your feet, and then you can have sharp electrical types of pains inside there. And lots of times it's aggravated when you're walking. There's quite often patients that come into the office have difficulty sleeping because of all the discomfort that they have in their legs. But they also experience pins and needles in there and tingling in their feet throughout the course of the day. There's weakness, there's swelling, and there's numbness. So, where it gets to be really, really confusing is how can you possibly have sharp stabbing pains in your feet when your feet are numb? Right?
Yeah, it's two different things.
Right. So how can you be having all these crazy sensations? How can you have like weakness in there when you're really kind of like walking around? But when people say, it's like this electrical sharp pain, and then they go, I can't feel my feet. It gets to be really, really confusing for people. And lots of times when it starts to develop a little bit more, some people start to lose a sense of balance. So that's kind of like serious with it.
Is that more like an internal pain, but like maybe the surface of the feet, you don't have a sensation? Is that it?
Well, the reason why there's such bizarre symptoms there is because there's two parts of the nerves, actually three parts that are really involved. One is the sensory changes. And you have receptors with all your skin that allow, and also in muscle fibers that allow you to actually sense like a sharp burning nerve type of pain. So if you have a sensory nerve damage, if the nerves that allow you to feel are involved in there, you're going to get that numbness and tingling and all those types of things. Sometimes it can cause a loss of balance. And then the other portion in there is the motor nerves, or the nerves that go to muscles, and that will interfere with the control of your muscles. You'll get some weakness in your legs. You'll get some loss of muscle bulk in there, dexterity, and sometimes you're going to get cramping. And if you're getting some cramping, that's also a sign of having some of the motor nerves. But here's the real important point: when you have both the sensory nerves involved and the motor nerves involved, a loss of balance becomes an issue. And the number one cause of death in people over the age of 65 are complications due to injuries sustained during falls.
Yeah.
So we're going to talk a little bit about that. That's a really, really serious condition. So if you're starting to lose a little bit of balance with peripheral neuropathy, you're in trouble. I mean, you better start doing something about it.
We're talking with Dr. Bob Olivieri about peripheral neuropathy. And let me see if I got your number right. If you want to give his office a call, 886-8585.
Yes.
All right. He's on Route 47 in Rio Grande. If you're not where you're supposed to be, you better get there. We'll be back with Dr. Bob in just a few minutes. Dr. Bob Olivieri once again here. Every Tuesday morning, he is graciously attending the show here and making us all a little bit smarter and a little bit more aware of our bodies. I certainly appreciate that.
Oh, it's nice to be here. It is.
So let's see. Today's topic is peripheral neuropathy. And you gave the definition and the symptoms. So what's the next step in this process of determining how to help yourself if you got this problem?
You know, it's an important note when people talk about certain types of diseases, like all chronic diseases, like a peripheral neuropathy, or things like thyroid condition or insulin resistance or diabetes, people that suffer from chronic disease or IBS or they all have some common threads associated with them, all of them. And basically what they involve is they all have metabolic imbalances. They have people could have like chronic inflammation, unstable blood sugar, some adrenal problems, hormonal problems, autoimmune types of issues there, food sensitivities, anemias. They're all things that really need to be checked when you're treating some of these type of chronic problems. There's also neurological imbalances to be able to influence your nervous system. So it's extremely important that you address all of those things. So even in our program, we have very strict dietary nutritional types of things that you have to look at, because especially if we're dealing with somebody that's diabetic, you're never going to get anybody but diabetic unless you address some of their metabolic issues. So all chronic diseases are a combination of neurological and metabolic problems, and they require proper treatment in both of those areas to be able to go and get that a little bit, to get them healthier. The nervous system is just such an important portion to be able to address in this, because if your nervous system itself isn't working, think about this. You have nerves that are going to all over the place. So you have your motor nerves that are going to the muscles. You have the sensory nerves that are going to your feet. But you also have a portion of the nervous system that also goes to your heart, your lungs, and all that, the autonomic nervous system. So this particular condition is affecting your nervous system, and it has a lot to do with the connection between your feet all the way up to your brain. So we're going to get into a little bit about that, but one of
the nerves, I mean, they all go to the spine, and as a chiropractor, that's part of what you do, right?
Well, really what it is, yeah. Well, the nervous system is your brain, your spinal cord, and the nerves that leave there.
Okay.
Well, where do they go when they leave there? They go to your heart, they go to your lungs, they aid in digestion, they aid in the
go everywhere.
Exactly.
Yeah.
Then they go into the periphery, allowing you to move your hands and feet and all those things. So your nervous system controls every single bodily function. The first two cells when you become human are nervous system cells, the formulation of your brain. So it is the importance of that, and chiropractors influence that tremendously. So I want to get back onto a little bit of some of the topic of what are some of the leading causes of peripheral neuropathy. Well, number one, we're going to talk a little bit about some things that may be a little bit of controversy. One of the things, and this is not in any particular order, but statin drugs influence peripheral neuropathy. They're cholesterol-lowering drugs. We're going to talk about that in a little bit. Lower back problems influence some forms of peripheral neuropathy, because some arthritis or spinal stenosis or some disc bulging also can compress some of the nerves that will mimic at least some of that. Diabetes and insulin resistance may or cause peripheral neuropathy. Chronic inflammation, such as food sensitivities, inflammatory foods, hidden infections, All can do that. High insulin really causes that. Chemotherapy is also one of the causes. So there are really only 5. Like I said, there's over 200 causes of that, but they're the ones that we're going to kind of address today. So I'll get into a little bit of that. The first one is I want to talk about is statin drugs. Now, I would never, this is not medical advice. I'm not giving you that. You get medical advice from your medical doctor who prescribes medication. So I really want to be very clear about that. But I want to take you through a logical thought process. Statin drugs inhibit the formation of cholesterol, right? Okay, that's why you take a drug. You see a blood test, your cholesterol's high.
There's a couple different types of drugs for that, right?
There are.
For cholesterol.
Yeah, there's quite a bit. But most of them are statins, almost all of them. And the primary function of those is to lower the cholesterol. But cholesterol is extremely important in your nervous system. Your brain is made up of a massive amount of cholesterol. All your nerves, cholesterol makes up the sheath of every single nerve in your body. So these nerves that are going down your hands and feet that are bad, they need cholesterol. Statin drugs also inhibit the formation of CoQ10 enzyme. So now you're starting to see some statin drugs, like one of them out there actually comes with CoQ10, but CoQ10 is necessary for nerves to function. So statin drugs do inhibit the formation of some of the cholesterol that's needed for your nerves to actually, so you'll see this a lot. So that's a conversation you want to have with your medical doctor. You want to say, something, my feet are going numb an awful lot here and I'm on a cholesterol medication. Can you help me with that? But also CoQ10 is a really, really nice thing to be able to add to it because CoQ10 is necessary for the nerves to actually function a little bit better. So I'm not prescribing anything. I'm not telling you anything. I'm trying to appeal to your sense of logic. But if cholesterol makes up the sheet for the nerves, and statins inhibit the formation of cholesterol, and CoQ10 helps the nerves function better. If you deduce, hopefully by yourself, that CoQ10 may be a good supplement you may want to add to your diet if you're taking a statin drug, especially if you have peripheral neuropathy.
I know that people need to take drugs for various reasons, for various issues, but whenever I see these commercials on TV and then they list all the side effects, it's just very, you have to, weigh the benefits of the drug versus the side effects. And again, that's the conversation you have to have with your doctor.
It is. And, you always really want to look at the inflammatory markers before cholesterol drugs are really taken, honestly, statins. I'm giving you a very strong opinion about that, but you got to look at that. You got to look at people's inflammatory markers on their blood work, before you're going to decide are they inflamed, because higher cholesterol right now is not as important as the inflammation, because cholesterol only sticks when you're systemically inflamed. Now, if you're over certain numbers, and again, that's a conversation you have with your family doctor. If you're over 300, that's a whole different call. But, if you're dancing around 220, where like 7 years ago, that was considered great. Mm-hmm. Over 300 was bad. They moved it from 300 down to 200. My strong personal opinion is, how about going from 300 to 280, or going from 300 to maybe 250, But it's really, the cholesterol is not a great marker. It's the inflammatory markers that you look at during blood work that will tell you, is the cholesterol sticking? Is it sticking to the arterial walls? It only sticks in the presence of inflammation. That's the only time it happens. So that's what you want to do, or if it's been going on chronically for a number of years. So look at those particular things, then you get a much better indication.
We're talking with Dr. Bob Olivieri from Olivieri Chiropractic. We'll be back with more of Dr. Bob and his discussion about peripheral neuropathy in just a few minutes here on 98.7 The Coast. We're talking right now with Dr. Bob Olivieri about peripheral neuropathy is today's topic.
Right. And we were just talking a little bit about some of the statin drugs. I want to make that, I know I said it 3 times before, and I want to make it 4 times, that, the conversation that you have about your cholesterol and your statin drugs and all those things, it should always be a conversation that you have with your family physician, always. And they know your numbers, they know what you've gone through. So you always want to have that. The only point that I was trying to make with this is that statin drug does increase the risk of peripheral neuropathy. And, one of the studies I have, God, so many studies I don't know what to do with, but one of the studies I use is in Journal of Neurology in May 2002 says that statin and cholesterol drugs increase the risk of peripheral neuropathy 16 times. That's 1,600%.
Wow.
Okay, so that's why I'm trying to make it a point on the show here, because it's not controversial. I mean, it's a fact. It does.
Well, I have a friend who has no problem telling me about his problems, his issues, his aches and pains. And he was having a problem with his feet, a lot of pain in his feet. And I believe he was on a cholesterol drug because he talked to his doctor about, what was affecting his feet. And they decided to stop taking this drug, and the pain went away.
Right.
But it didn't go away right away. He said it'd be 2 to 3 weeks. It took almost a month for that to get out of his system.
Sure. Usually, 4 to 6 weeks would actually take that before you'll start to see some of the changes.
Right.
And that's a conversation you have with your family doctor. I mean, if you're not having any symptoms, that's a whole different scenario. But it does. If you're having some symptoms, of course, your family doctor wants to know that, right? But my point from a functional medicine standpoint primarily is really, it's not really necessarily the cholesterol is the enemy. And the enemy is chronic inflammation. And, we need to be able to have a process, and we get the chronic inflammation from toxins and foods and all those types of things. So the take-home message I'm trying to say is cholesterol is never going to really clog your arteries unless you're chronically inflamed. And you need cholesterol for proper nerve and brain function. The number 2 on our list we just talked about was lower back problems can contribute to some irritation of the nerves that go down into your legs. Spinal stenosis does it, degenerated disc, bulging discs, degenerative arthritis. They all have one thing in common. They all put the pressure on the nerves that go down into your legs. We have some pretty fancy equipment in our program to actually help alleviate that particular problem. One of the other things in here is diabetes and insulin resistance. That's a really big deal for people having peripheral neuropathy. And here's another thought I want to kind of take you through. Your nerves need a lot of energy to survive, right? That's how, you need to be able to have that for that. The nervous system is powerful. Like the nervous system, it takes up 30% of your energy supply. So it needs lots of energy for your nerves to survive, your brain and your nerves. Glucose is the nerve's source of energy. So your nerves need glucose in order for that to happen.
Is that sugar?
It is, but it's in different forms of sugar. Basically, you have carbohydrates, right? Fats and proteins.
Right.
Well, as those carbohydrates break down, it breaks into usable forms of sugar, and glucose is one of the things you really need. Not high levels of it, because as we talked about, that's a bad thing.
Right.
But glucose, you need that. When you have too much glucose, it's stored into fat cells. So a lot of people think that you eat too much fat, you get fat. That is the furthest thing in the world from truth. If you have too much sugar, it turns into fat. So sugar is like the one of the worst things you can actually put into your diet in the simplest form. Complex carbohydrates, very good. So let me follow go through the thought process. Nerves need a lot of energy to survive. Glucose is the nerve's source of energy. Insulin is a hormone that puts glucose into the nerve cells. So you need this hormone. So when you're diabetic or insulin resistant, glucose can't adequately get into the nerve cells, and the nerves get fatigued. When nerves get fatigued, you develop numbness, tingling, pain, weakness, and all those things. So here's the simplest way I can put it. You eat some food that has glucose in it, simple carbohydrates. It gets absorbed into your blood system. So now you don't want a whole lot of glucose just floating around in your blood. It needs to get to cells, whether it goes into a muscle cell, whether it goes into your heart cell, whether it goes into your whatever. If it's getting into a nerve cell, which it needs to get into any cell, it needs insulin. So insulin is secreted from your pancreas. As the blood's going by, it's saying, okay, we need to get this blood sugar into the cell.
Right.
So insulin is secreted to be able to do that. But when you're diabetic or insulin resistant, the glucose can't get out of the blood and get into the cell for it to be used. So that's a big deal. I mean, that's a big deal. So now it's floating around. So now you have insulin, which is highly inflammatory in your blood system. You got excess glucose, which it doesn't know where to go, so it deposits into adipose tissue, into fat tissue inside there. And the cells that really need it can't get it. So whatever that muscle cell is, the muscle is going to get weak. But in this case, we're talking about nerve cells. So you're going to get numbness, burning, pain, weakness, tingling. So diabetes and insulin resistance. Now, when that stuff's not getting into the nerves begin to die. They begin to die off. And that's a horrible, horrible condition. And the drugs that they give doesn't change that process here. And we'll talk about that in a minute.
All right. We're talking with Dr. Bob Olivieri. He's our guest every Tuesday morning. You can contact him at his office on Route 47 in Rio Grande. The number is 609-886-8585. All right, Dr. Bob, we're talking about peripheral neuropathy here on the show today. And I have a feeling there's a seminar or something coming up. We'll get to that in just a minute. But Dr. Bob, it's been very fascinating as usual. And what else you got for us?
Well, some of the other things that are contributing to some of the causes of peripheral neuropathy, some of the most common ones are really some of the inflammatory things that we actually consume during the course of our life or during the course of our day. Many metabolic issues need to be addressed before you're going to be able to put out that fire. And chronic inflammation, based upon some of the toxins that we put on our body and some of the foods that we ingest, influence that. We have food sensitivities and inflammatory foods that we'll eat. We talk about those often on this show, such as certain glutens. Certain people have allergies to milk and casein and soy and all those other things. So we try to address those in our program, and you need to address many of these metabolic issues if you really want to fight the battle of peripheral neuropathy. And I always ask any of my audience whenever we're talking about peripheral neuropathy, if you can't feel your hands or your feet, what do you think's happening up in your brain? There's an actual map. Your left side of your brain controls your right side of your body, in essence. And so if you stub your toe, there are nerves that go all the way up into the back part of your brain called your parietal lobe. And there's an actual map of your toes right in the midline of your brain that will light up like a Christmas tree. So that sensation will forward that information to your motor cortex in the front part of your brain, your frontal lobe, and it will go all the way down and tell you to move your toe. So that's an entire wiring system. So
it happens instantaneously, right?
It does. And so what happens with that is if you can't feel your feet for a long period of time, there's a ton of studies out there showing that it's starting to affect your brain function. People don't think about that. It's affecting your brain function. You need to stimulate nerves and stimulate your cortex in order for that neuroplasticity to continually exist. And when you're not wiggling your toes, that's why any peripheral neuropathy patient comes into our office, you got to get moving. And here's the thing, they don't want to get up and move because they can't feel their feet and they feel unsteady.
Right.
But you got to get moving. If you don't do that, you're losing it. So, one of the studies that we talk about, it says in there, peripheral neuropathy, it says differential diagnosis and management. One of the things in there says if you cut your nerves, you change your brain. And not only are you just changing a little bit, you can start to see loss of balance, memory loss, depression, anxiety. There are some cases of Alzheimer's disease, dementia, insomnia coming from that. And you're like, wow, that seems bizarre. Well, it's not bizarre. Your nervous system is one contiguous unit. We just got done talking about that. Your brain, your spinal cord, and all the way down to the nerves. So what do you do for it? Well, there's proper nutrition that you can actually apply to it, which is a huge part of our program we're doing with this. You got to be able to go take on an anti-inflammatory environment. There's essential nutrients you need to add. You need to increase your oxygenation of your tissues. And most importantly, the program that what's so important that we do that nobody else is doing is nerve activation. And we use multiple tools. It's multimodal, we call it. We use certain types of tools in there, from electrical current to multiple levels of electrical current to laser to light to vibration to all these different things to wake up nerve sensation, drive that blood into the nerves, allowing the nerves to try to repair themselves. And we also do it with some nutritional stuff. So it's a very, 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 very powerful program. And we try to explain this to you in great detail. And we offer a seminar to do that because it's complex. And so when I can actually stand in front of you and explain to you what we're actually doing, it's much easier to, and actually show you the equipment that we have, it's much easier to be able to say, okay, this is why what we're doing, besides taking Lyrica or Neurontin, or which are anti-seizure medications, by the way, they're not even designed for peripheral neuropathy.
Wow.
They may or may not be helping you, but for the people that it's not helping, this is a great, great, great alternative. The problem with peripheral neuropathy is it is a slow degenerative process, and sometimes it's not slow for people. Sometimes they go from feeling it in their feet to the next year they're on a cane, and the next year they're on a walker. And you see this a lot.
Well, you say it's degenerative, Dr. Bob. Is there any point where you can't bring it back?
That's what our hope is. What we do is we go through a very complicated, complex neurological exam to evaluate the severity of it. If you're greater than 85% loss in your nerve functioning based upon our exam, I can't help you. You let it go too long. Unfortunately, we've been seeing a lot of those cases in the office. Men are horrible. Men are always like, oh, it's not that bad.
They never want to go to the doctor, yeah.
But they're horrible. Oh, it's not that bad. So if you're a wife or a daughter, of a father that has this, just you get them to come to the workshop because, you got to wake them up a little bit. It's really difficult dealing with men because they're stubborn and they can't even feel their feet.
When is the workshop?
It's Thursday at 1:00.
Thursday, 1:00. And you have to call for a reservation.
You do. Yeah. You have to reserve a seat with this. And these workshops are extremely well attended. We advertise all over South Jersey. So we get a lot of people traveling really, really far for this program. Really far.
Is there a charge for the workshop?
There's not. There's no charge for the workshop. You just get a chance to really understand what our program is, the protocol that we're doing, why it's so unique, and just don't wait too long. I mean, it really, I can't explain to you how sad it is for me to tell somebody, there's nothing more I can do to help them. Because half the time they don't even know they're that bad. You can stick a needle all the way down through their foot, and they're like, you feel that? And they're like, feel what? Wow. It's sad. I mean, it really is, and it's an epidemic. I mean, it's so profound in Cape May County, Cumberland. I don't care where you are, South Jersey area, and we have people traveling really, really far for this. So it's a great workshop. You get a chance to learn an awful lot about our very, very unique protocol. There's nobody in South Jersey doing all the stuff that we're doing right here. We spent over $300,000 worth of equipment on doing and actually treating this particular protocol, this condition, and we want to make it the place where people are going to travel to. And so we're trying to make our whole office that way.
Once again, it's Dr. Bob Olivieri. His number is 609-886-8585. And he's online at, what's your address online?
It's OlivieriChiropractic.com.
Thursday at 1 p.m.
Yeah. If you want to learn more a little about this, you go on ZAP, Z-A-P, peripheralneuropathy.com. ZAP, peripheralneuropathy.com. We have some information on there, and if you actually put an email in there, you're going to get a ton of information about the program that we use. So if you're interested in more, but the best way to get the information is come to the workshop on Thursday.
Dr. Bob, thanks so much for joining us, and we'll see you next Tuesday, right?
Thank you very much for having me on.